You know, some people have a fear of the dentist when they're kids. And unfortunately, for some adults, that fear is still with them. Or if it's not the fear, there could be a cost barrier, or who knows what reason would make you not go to the dentist. We get our eyes checked. We should get all of us checked, including our teeth, our mouth. Oral health is very important, but a lot of people are just not doing it. We'll address some of those reasons today, so stay tuned. Hey, good morning, everyone, and welcome to Scan FYI. So this is kind of a first for us because we've never been fortunate enough to be able to speak to a dentist. So my guest today is Dr. Sally Jo Placa. And Dr. Placa, thank you for being with me.
Oh, my pleasure, Andrea.
So why don't you give a little bit of an intro about yourself and what are you up to?
Sure, I'd love to. Well, I'm a practicing general dentist. I've been practicing for 33 years. I have a private practice in Avenel, New Jersey with my husband, Dr. Madsen. We've been practicing together since 1991 and we still love each other.
Pretty good.
It's a general practice and we pretty much do everything in general dentistry, root canals, dentures, implants. We surgically place implants and make dentures to clip into those implants. But in addition, I'm also the general practice residency program director at Jersey Shore University Medical Center. We have 5 general dentistry residents there. And we are fortunate enough to have some of the dentistry funded to the community for senior citizens by generous grants from Delta Dental Corporation and the Philadelphia Foundation. So we do offer services to senior citizens that are underwritten by those grants from those foundations.
Right, and just for our listeners out there, we will put a link to that. We'll put all the info in case you want to reach out to Jersey Shore Medical Center, to that dental unit, because I think that would be that's really excellent for people to know.
Thank you.
So, you know what? Let's just get into this. Why is your oral health, your dental health, it's equally important as you're older as when you're younger, but why is that so?
Well, as we age, good nutrition is imperative to sustain good overall health. So, to keep your mouth healthy, to be able to eat properly and masticate your food, chew your food, is imperative. And as we age, we start to encounter some limitations with our teeth. So it becomes even more important to make frequent visits to the dentist to help maintain overall oral health. I mean, I always tell my residents, health starts with your mouth, and sometimes the medical community forgets that the mouth is in fact connected to the body. So that we try to get the word out that it's extremely important at every age, but even more important as we get older to make frequent visits to the dentist for ongoing preventive care, checkups, X-rays.
Mm-hmm. Mm-hmm. So it really never ends. Just throughout our lives, we need to be going to the dentist. And so what are the things that we need to be doing hopefully we are seeing the dentist, but what are some things that we can do at home to just ensure that everything is going well, that we're taking good care of ourselves?
That's a great question, because I think people ignore what they need to do at home. But for sure, you should be seeing the dentist at least 2 times a year, sometimes 4 for preventive care. But we should be brushing and flossing every day, without fail, every day, with a fluoride toothpaste, dental floss, special picks, water picks. And as we age, it becomes even more important because we produce less saliva as we age, because our salivary glands start to shrink and not produce the same amount of saliva as when we're younger. So when your mouth becomes dry, you're more prone to decay. So what you do at home is even more important. And sometimes what we recommend for some of our more mature patients is a fluoride rinse at home. Even we do fluoride applications in the office like we would do on the children. We start doing that more frequently as our patients age. And you know, sometimes special fluoride gels are recommended. Sometimes we recommend biotine or salivary enhancers to keep the mouth more moist. So this way, the decay rate doesn't go up. So there's a lot of modalities that we recommend. In addition to, like I said, at home, brushing and flossing every day.
And every day doesn't mean flossing once a week. I know. Yeah, every day. Every day means every day.
Every day.
Right, right. You want to keep all, I find as you get older, lots of people, we've had new knees, new hips, new shoulders, all right, new teeth, but you want to keep what you have. So this is one way, and this is about as low tech as it gets, right? Brushing your teeth and flossing. Come on, guys.
As low tech and as cheap as you can possibly get, right?
Yeah, really. Your dentist will thank you for that.
Very inexpensive.
Now, I'm sure that, certain people who are on all different kinds of medication too, and that probably has an effect on your teeth as well.
Yes, getting back to what I spoke about before about, your saliva decreasing and your mouth drying out. Lots of medications and many times cardiac medications will dry your mouth out, and that makes you much more prone to decay. Patients who go through cancer treatment, chemotherapy, we see it all the time. We see a spike in their decay rate because the cancer medications dry out their mouth. Now, of course, you're going to have your chemotherapy because it's life-saving. But when that starts, you need to be mindful that you should be using saliva substitutes to keep your mouth moist, staying away from certain types of candies and foods that can really spike your decay rate, like hard candies that you suck on all day long. Okay, just bathe your mouth in sugar, and we see huge spikes in decay, and especially chemo patients, because their mouths are so dry. They're looking for something to help enhance their saliva, and that's just the wrong avenue to go down. We often recommend hard candies, but sugar free. Anything with xylitol in it actually is anti-cardiogenic, so we'll recommend those things. Chewing sugar-free gum can help stimulate saliva production, so those kind of things. But sucking on lollipops is terrible, and we've seen some catastrophic effects from that.
So it sounds to me, if you're being treated for something that's affecting your teeth, you really need to have a conversation with your dentist to see what would be some good solutions for you, not just necessarily speaking to your regular doctor, but including you. I feel like a lot of times people don't think to include their dentist as part of their overall medical team.
You bring up a very important point, and we beg the oncologists to please, before they start chemotherapy, to send their patients to us so we can first make sure that they're dental disease free before they start chemotherapy, and then also review with them what they need to be mindful of and what they need to be aware of with the side effects of chemotherapy. So when and we have some oncologists that are really good about that, and so those patients actually do very well. But sometimes these physicians are saving lives, so I can understand.
Of course.
Yeah, some things take a back burner, and they forget to advise their patients to go see their dentist and make sure they go regularly. But when that happens and they finally come to us because they're in pain or they're swollen, they have infection, like I said, it could be catastrophic at that point.
But that's where older adults, we need to be our own advocates, and hopefully people will be listening to this and say, oh, I never really thought about that. But you know what? Now that we heard this, I think I need to talk to my dentist. So I think that's a very important point. And, as far as the foods that, I mean, what are some of the things that we need to avoid? And the hard candies, that my mom, her whole life, she seemed to carry a bag of hard candies with her. And I know that a lot of people are very guilty of that. Never sugar-free, of course. But what are some things beyond sugar that might be important to avoid to kind of preserve your teeth?
Well, of course, candies and sugary foods and that kind of thing. People don't think about raisins as being not raisins. Yeah, it's very sugary and sticky. So not
sticky.
yeah,
Yeah.
that sugary, sticky food sticks to your teeth and causes decay. And I'm not saying don't eat them. What I'm saying is, you might want to consider brushing and flossing after you had it. Same with apples. The skin from the apples has a very high sugar content, and it can get in between your teeth and cause an apple a day keeps the doctor away, but doesn't keep the dentist away. So
there you go. You heard that from the dentist.
So have your apples, and I'm not saying don't eat apples. Have your apples; it's a great food, but consider brushing and flossing afterwards.
All right, so we're not saying don't do it, but we are. It's a great reminder that brushing and flossing every day makes your dentist happy and your teeth happy. Yeah. So what do you want to say to someone who has that still like a little bit fearful of going to the dentist? Forget everything else, all the other barriers. I know that there's a lot of people, adults included, that still have the fear of the dentist. So how do we allay their fears?
The techniques have changed so considerably. I think back to when I was in dental school and, what I was taught in dental school compared to how I'm practicing today. I mean, it's night and day.
Really?
Yes.
Okay.
It's really
in a good way. In a good way.
In a good way, yes. How we did root canals 30 years ago is much, much different than how we do them now. There isn't that post-treatment pain that people have had in the past. Because I can't tell you how many times patients will come in for root canal with me, and they'll tell me about their war stories from 15 years ago, and I reassure them the techniques are much different now, not to expect that. And sure enough, they come back and they say, you know what, I didn't have any pain. And I was like, yep, we have to trust in the technology and in the science. It is much better today, and it helps to allay patients' fears. Once they've experienced that, then they realize that no, it's not the dentistry of yesteryear.
The more traumatic version.
Yes.
It's not the more traumatic version. Yeah.
Yes. And I've placed implants on patients and they've gone to work. I've done the surgery and they've gone to work after the appointment. And when they come back for their post-op visit, I asked them how they did at work, and they said absolutely fine. So the techniques are just head and shoulders above the dentistry that has been in the past.
So what about the idea that, a lot of times when we're meeting a new doctor for the first time, and maybe we want to have a little, I'm going to call it a consultation, patient to doctor. Do you even feel like with a dentist that could help folks feel a little more comfortable?
Oh, sure. Sitting down and I love when patients tell me that, gee, I'm really afraid. And so that helps me to reassure them. And I explain to the patient, you're in total control. If you're uncomfortable, you need to stop me and I'll make you comfortable, because, and I tell my patients, I said, it's really selfish on my part, because the more comfortable you are, the easier it is for me to work.
Naturally.
If you're uncomfortable, it's very stressful. So, I try to allay their fears that way and explain to them that, please stop me. If you're uncomfortable, I have, plenty of Novocaine, or we'll do whatever it takes to make you feel comfortable, so that, you can, get accomplished in your mouth what needs to be accomplished in a comfortable way. And I don't have to get any more gray hairs.
Yeah, nobody wants that, right? Yeah, I think that like we do say this a lot at SCAN, is about, we talk about communication and advocating for yourself. And I think it's really no different, whatever kind of doctor you go to, have open, honest communication. Because how can you possibly help me if I don't share my fears or, my whatever concerns I might have? So I think that's an important thing for everyone to remember. I think then it's probably a better experience for the patient and the dentist.
Absolutely. And I tell patients, you don't have to be a martyr. You don't have to white knuckle.
Yeah.
Stop me. I'm not going to be insulted. I want you to stop me. And I, try and make you as comfortable as I possibly can.
Sometimes I hear from, of course, at SCAN, all of our members are older adults. And sometimes we hear people talk about that they believe that as you get older, the need to go to the dentist is not as important as when you were younger. But clearly, that is incorrect.
It's much more important as you age. So in younger life, it's important because, the teeth are erupting and we want to keep them, disease free. So and we see higher decay rates in the younger population, and then they go down in the 30s, then the 40s, and then the decay rate starts to go back in the 50s and the 60s and the 70s because of some of the factors that we talked about, medications, aging salivary glands, decrease in saliva. So that's why we stress the importance, especially as we're becoming more and more mature, to continue with going to the dentist for regular visits and checkups and cleanings.
Dr. Placa, I love how you say, as we're getting to be more and more mature. Very diplomatic of you. I like it. I might use that sometime. All right. Well, so you've heard it from the dentist herself. Going to the dentist as an adult is as important, if not more important, than going as a kid. Be open, have honest communication, brush and floss on a daily basis, right?
Yes, every day.
So maybe a final thought to share with everyone out there?
Just, be open-minded with your dentistry, and ask questions and be honest, and don't feel like you should have to suffer through a procedure, and maintaining good oral health into the more mature years is so imperative for good nutrition and just overall good self-esteem.
One last thing I want to mention, because many people have had a hip not a transplant, a replacement, a knee replacement, etc. And is it still an accurate statement that when you go to the dentist that you need to be on an antibiotic in advance?
So yes, the regimes have been changing over the years, but if you've had a heart valve replaced, hip replaced, a knee replaced, generally you'll have to take an antibiotic prior to coming to the dentist, and that should be discussed between the dentist, your dentist, and the medical professional that did the replacement as to what regime antibiotic regime they'd like you to take. But things have been changing over the years.
But there again, communicate with your dentist.
Absolutely.
Your dentist is not, you can't know you had a knee replacement if you don't speak up. So I feel like that's sometimes the worst barrier, is just not being honest. Not even honest, just not mentioning these big details, right?
And yeah, I don't think it's about honesty. A lot of times what it is my dentist doesn't need to know that. And that's so untrue and so dangerous. I had a patient come in and he had an aortic shunt put in. And if it wasn't for a good talking to the patient, good communication, going through the medical history, he never would have told me he had an aortic shunt put in, which is extremely important when you're at the dentist.
So here again is the importance of recognizing that your dentist is an integral part of your healthcare team, and you have to treat your dentist that way and share those details. Yeah, very good. Very good. Well, thank you for sharing this information. I hope you've done a lot to allay people's fears and reminding people brush and floss every day. every day. Okay, thank you, Dr. Placa.
Pleasure.
All right, so remember out there, if it's important to you, it's important to us. I'm Andrea Tarr. We'll see you next time on Scan FYI. Bye, everyone. Bye, Dr. Placa.
Bye-bye. Thank you again.